Hello, this is Clyde Church, La Plata County Commissioner, coming to you on Zoom with Liane, Jollon, Director of San Juan Basin Health. And so we're here to bring you up to date on the situation on a number of current issues, the COVID-19 pandemic. Liane, do you have a question for me?
Well, I think we all had a pretty close call in the last day or so with the 84 fire in La Plata County. And I thought maybe we would start there because we're already kind of, all hands on deck with an emergency response to a global pandemic in our communities. And so how do we have the capacity to, respond to more than one thing at one time? So I'm curious how that played out this week for you guys and for all of us together.
Yeah, so tonight we're stable. Pre-evacuation orders have been lifted, and we're looking pretty good. A few hot spots still that are being mopped up, and but I think everybody can sleep well for tonight.
Thank you for that update, Commissioner. San Juan Basin Public Health staff was working with your staff yesterday as we learned of it. And, once the pre-evacuation orders were issued and there was thinking about what some of the consequences could be, we, went to work with La Plata County Human Services staff to start penciling out what sheltering would look like if we had evacuations due to a fire, while we're still fighting a pandemic, because, there's some real concern while we potentially still have community transmission of infection. How would we keep people in a sheltering situation without adding to burden of infection in a community? Unfortunately, while we're in a global pandemic, everything that we do just takes layers of complications and operations that we have to kind of invent as we go, because a lot of this stuff isn't, there isn't a plan. We're not going to be able to find off the shelf our plan for fighting a wildfire during a global pandemic when there's not enough diagnostic testing to know, if there's infection amongst people who are sheltered or people who are fighting the fire. So we're really relieved that it's ended up in a good place for now, but we have a lot of work to do, unfortunately, still.
Sheltering during a pandemic and sheltering during a fire, those two together means lots of floor space needed for cots and sleeping facilities or division of people and separation. So people need to understand the seriousness of this. And please, please be careful with fire. Be careful with saws, chainsaws, all kinds of outdoor equipment that could cause sparks, even lawnmowers. Ignition points are very low right now for pine needles. Break up the pine needles, make a safe boundary around your homes. Be fire safe, be fire smart.
I think you're giving such great tips about how it's all of our responsibilities to avoid, starting a wildfire. And, similarly, it's all of our responsibilities to keep at the activities that will stop spread of infection. We're not moving into a new phase of this where we're encouraging people to relax social distancing. Quite the contrary, we really want people to stick with all the social distancing, make some small changes if there are things that you need to do. But just like you should be really careful not to start a fire, you should be really careful to not spread infection. And that's going to position all of us as a community to, avoid deaths in our community and move into recovery, right? We're still responding, and we want to get to that recovery time.
So as we start opening up, we have a new program for business self-certification. Returning to normal, I guess, as I understand it, is conforming to all these other new restrictions that we put on ourselves while engaging in business. Can you tell me more about this self-certification, how this ties together with masks and distancing and everything?
Some people are referring to it as a soft opening. They're not business as usual, right? The self-certification program is so that businesses can really kind of, get in there, read their guidance, look at the list of resources that they need, and then determine, do I have the resources? Can I train my staff? Can I reasonably, start doing a little bit of business and also not spread infection? As of this morning, it was I don't know, somewhere close to 300 businesses had started their self-certification process. And the comments from, staff that's reading them is that they're really, really good. Businesses that want to kind of take these steps are really reading it carefully and putting forth some very thoughtful plans about how they can engage in commerce or provide a needed service to the community, and also keep not spreading infection in the forefront of their activities. So we're pleased to see it unfolding that way. But we also know that we have to have really good testing and case investigation in place, because we need to know if these loosening up of restrictions lead to increased cases, or if we're able to maintain a nice low case number that we have in this community.
So wait a minute, I need to understand this. The relationship between policy and caseload and hospitalizations and deaths is related to policy. Can you tell me a little more about that?
We know that the way that we're social distancing is absolutely very difficult for businesses, for families, for education. All of that is just so hampered by social distancing. It's not the tool that you want for controlling communicable disease. It's too blunt of an instrument, and it's too difficult of an instrument. But because COVID-19 was spreading so quickly, it was the instrument that we have. What we're trying to do now is move into a phase where we can still prevent death, and prevent sickness in our communities, but wind back some of the really difficult pieces of social distancing. So policy is absolutely related to saving lives. It's our job, right, to save lives. It's also our job to allow people to live, which requires being able to go to work, be able to get an education, right? So we're starting to move into that space, but we're doing it in a very careful, measured way with lots of education. That's what the self-certification plan is, and with checks and balances. And if any of those indicators are going in the wrong direction, this policy may not only go one direction. We may have to go back to tightening restrictions, because we don't want to cause any tragedies unnecessarily in our community.
So as we open back up, one of the natural things that will happen is that many of our workers come from New Mexico, and many of our Colorado or La Plata County residents work in New Mexico, and we'll have this back and forth cross-border traveling. Is there anything that businesses in La Plata County should be doing to help safeguard and check the employees coming from New Mexico? Not that it's unusual, or somebody shows up to work and says, I don't feel so good. Is there any equipment or methods or policies that employers should be looking at here in La Plata County to help identify those workers that might not be ready to come back to work?
Right. So that's a great question. So we agree there's a ton of regional connectivity here for workforce and essential activities. And all of that is addressed in the safer at home guidance that's issued by the state of Colorado. So we did not issue additional guidance. We issued a self-certification program so that businesses can read that guidance and learn, okay, so for my business, how am I going to ask my employees to track their symptoms? How am I going to ask my employees to stay home if they are experiencing symptoms? What is my responsibility for hygiene and sanitation in my workplace? What is the, where do we refer employees if they are symptomatic and need to be tested? What other kind of testing do we want to offer in the workplace if we find evidence of a cluster? So all of that is addressed in great detail in the guidance, and that's what we've been pushing for the last week or two, is getting businesses in there to read all of that guidance. The answers are different depending on the risk of the business that you're engaging in.
And the self-certification is all online?
Yes, it's all at San Juan Basin Public Health's website, the self-certification, the links to the guidance. It answers the exact questions that you're asking for. And, we agree that we want to see absolute decrease in cases, and we want to see that decrease everywhere. We are able to stabilize and see flattened growth and decreased growth of cases here in our communities. We know that our surrounding communities are not as lucky as we are. So it's going to take all of us, if we're, starting to bring some workplaces back on, to take this very, very seriously.
I would just like to say that please, as we loosen up, it means loosening up business, but keep your masks on, maintain distances, be healthy, be safe, wash your hands frequently, use sanitizer, all of those good things that we've all heard about. It's all part of our lives now. It may be here for weeks, months, or years. And until we get a vaccine, we can't control it. And distancing and separation is our best tool.
Thank you, Commissioner Church, and
All right.
let's.
Be safe, La Plata County.
Thank you.